I think it's plausible. We may not have the scientific evidence, all of the scientific evidence to prove that's what's happening, but it's highly plausible if you think about the mechanisms involved, because we know that high blood glucose levels increase the risk for heart disease and heart attacks. For example, women who have type 2 diabetes, of course is characterized by not being able to control blood glucose levels. So, and we know that women with type 2 diabetes are up to 5 times more likely to have heart disease than women who don't have type 2 diabetes. So there's definitely a strong link between out of control blood glucose levels and damage to the inside wall of the arteries. And we also know that high blood glucose levels can cause inflammation as well, so they can trigger this inflammatory response that we know is associated with heart disease. And also there's a substance called nitric oxide which allows the blood vessels to widen to allow the circulation, better circulation. And when the blood glucose levels are too high, then they can inhibit the body's production of nitric oxide. So high blood glucose prevents the blood vessels from fully opening to allow the circulation to go through correctly. So those are all mechanisms that are already understood and known about that could directly cause damage to the inside wall of blood vessels and cause a problem that way. But in addition to that, we know that saturated fats and cholesterol are incredibly important for every cell within the body. And the outer membrane, or the skin of all the cells within the body, require cholesterol for its physical structure. So cholesterol and saturated fats provide the structural rigidity for the membrane of every cell in order for the contents of the cell to be protected from the external environment. But we also know that cholesterol is important for the actual intelligence of the cell as well. So recent research has been published to show that derivatives of cholesterol are involved in key signal processes between the cell and the outside environment as well. And also that the brain and the nervous system are the parts of the body which require even more cholesterol than anywhere else within the body. So you've got the combined effect. You've got the potential high blood glucose levels, or fluctuating blood glucose levels, potentially causing damage to the inside wall of the blood vessels, but also the fact that the actual cells in the brain and the nervous system are not being able to do their job correctly because they're being deprived of the fats and the cholesterol that they desperately need.